Hello, everyone. My name is Chanel Bell. Today, I'd like to talk to you about something that most people don't think twice about. It's a simple hand squeeze. As you can see from the title of this presentation, we will be discussing the grip strength test, known as GST, and also referred to as hand grip strength test, abbreviated as HGST. Now, let me start by asking you a question. How many of you think that your handshake could actually tell you something about your overall health? Most people probably would say no, not much. Maybe it could tell me how strong I am, but not really realize that a single hand squeeze can actually tell physicians so much about a person's overall health and even their brain health. But, let's talk a little further about it. What if I told you that a simple 5-second squeeze could give healthcare providers to something about your age, your independence, even if you're at risk for diseases like dementia or heart disease? That exactly is it. Why, a hand grip strength test is needed. At a first look, it seems like it's just a basic physical assessment. But over time, physicians, as I'm saying, has realized what type of results they're able to get from the grip strength test. Today, I'm going to explain how this simple test has become one of the most valuable screening tools used in psychology, medicine, rehabilitation, research, even geriatric care. So let's look a little further. As we're diving in, guys, I'd like you to meet the hand. The hand is composed of so many muscles and tendons that sometimes it goes unnoticed as to really what is happening when we make certain movements. Just to give you like a quick fun fact, more than 30 muscles work together every time you make a fist or even just shake someone's hand. Surprisingly, most of the muscles that create your grip, it's actually located in the forearm, not even the hand itself. So while we often think that our grip strength is all about the hand, it's actually not. It's the forearm and the hand and even so much more. Like, let's just dive in a little further while we're talking about the hand. Our grip isn't controlled, as I'm saying, by our hand. It's our forearm, right? Yes, our forearm, but it goes further. It's our brain, our spinal cord, our nerves. These are all muscles that communicate instantly, simultaneously together to produce a strong squeeze. That itself is the reason why the grip strength test does provide physicians and clinicians with answers that can help their patients neurologically and as well as show them if they may be just at health risk as they age on throughout life. Now that I have you a little more interested in the hand itself, let's dive in just a little further. To give you a little idea of what I'll be covering is we'll begin discussing exactly what the grip strength test is and how it's performed. Then I'm going to explore why psychologists and other healthcare professionals have become so interested in the assessment. Then, after that, we're going to discuss the reliability and the validity, which are both two of the very important psychometric properties that allows this test to have or to hold the standing it does globally. Worldwide, this grip strength test is used as a health biome marker. Then, before we are all done, we're going to wrap things up and we'll talk about the ethical and the cultural considerations because even something as simple as measuring grip strength has to be interpreted fairly. So, what is the grip strength test? Right? What exactly is it? Simply put, it measures the maximum of force a person can produce by squeezing a device called a hand dynamometer. Now, most of us, we use our hands constantly throughout the day without even thinking about it. Thinking about opening a pickle jar, we just pick it up and we do it. Carrying groceries from the car, it's just an automatic. You grab it, the handles. Picking up your child, you don't think twice, you just do it. Turning a doorknob, even holding the phone while scrolling through social media. Every one of those activities that I just mentioned, that depends on your grip strength, on whether or not you'll be able to do it. Think of older people. As they age and their body goes through wear and tear, they struggle to hold those grocery bags that were once just so easy. Now it's quite a difficult task for them because their grip may have weakened. While their grip has weakened, so many things in their body and their health has also declined. And physicians now are able to even notice this way early on. So people who have difficulty performing these simple tasks, they often just have a lower overall physical functioning as well. This is why healthcare providers, they don't just see the grip strength test as just a simple hand test for strength anymore. They see it as like a quick snapshot into a person's overall health. And some can even use the results to find out about a person's brain functioning when it comes to things even as dementia. The grip strength test can let physicians see the risk level that their client may be facing before it's too late. Meet the hand dynamometer. This little device can tell so much. Think of it almost like stepping on a bathroom scale, but instead of measuring your body weight, it measures how much force your hand can generate. The patient simply squeezes the handles as hard as possible for about 5 seconds. The device then gives a number in pounds or kilograms. It's quick, it's painless, it's inexpensive, and because all of these devices you see are easy to use, healthcare providers all over the world use these devices every day. Now, let's look a little further. So now that we have seen the hand dynamometer, we may think, I could just pick this up and squeeze it. Wrong. That is actually not true. As simple as this test is, it does need the proper administration. And as mentioned before, administration takes approximately 5 minutes. This test has to be standardized, meaning patient needs to be seated, shoulder needs to be neutral, elbow at 90 degrees, forearm neutral, and then the test is going to start. There'll be 3 trials, and the highest or the average score being recorded is going to be what makes the result. So imagine trying to compare two students taking the same exam. One gets to use notes, the other doesn't. That wouldn't be fair. The same idea applies here. Everyone has to be tested in the exactly same position. So, to do that, that's why the patients are seated Their shoulders need to stay relaxed. Their elbows is bent at, as mentioned, the 90 degrees. Their forearms stay straight, and then the test is going to be usually repeated 3 times. Some people don't give it their best the first time. So that's why collecting an average of the 3 trials will give a more clearer reading. It makes the results more accurate. When looking at an assessment, one thing is always going to stand out: reliability. Can we trust the results? That's what reliability tells us. Think about weighing yourself on a scale. If you step on it 5 times in a row and it gives you 5 different weights, would you trust it? Probably not. The hand grip strength test performs very well in this area. The values are between 0.90 and 0.98, which psychologists consider excellent. The reliability on the grip strength test is excellent. That means if someone takes the test today and again tomorrow and under the same conditions, we expect the scores to be very similar. That consistency is exactly why the clinicians trust this assessment, because of the reliability rate of the test in itself. Did you know that our hand, it contains 27 bones, 29 major joints, and it's controlled by over 30 muscles. The hand is one of the most complex structures within the entire human body. Now, most people, they think that the grip strength comes from the hand. Surprisingly, it's not. As I have been discussing, most of our grip strength, it actually comes from the muscles located in our forearm. The hand is simply just where all the force comes together. Doctors, physicians, researchers, they notice that when giving the grip strength test and the results that they were finding, people with the stronger grip strength, they tend to have a better overall muscle strength. They had more independence, lower rates of frailty, better cognitive functioning, and even lower rates of depression. Thinking about it, let's just think an older adult living alone, if they begin having trouble opening medication bottles, carrying their groceries, or even getting out of a chair, those simple changes are, they may be actually early signs that something larger is happening in their health. This is why the grip strength test is so important, and how it's just become such an important screening tool. It's literally used worldwide as a global health biomarker, meaning across various countries, clinicians, they use it in a large scale of studies just to give patients proper treatment so that they can better navigate health risks. Now, let's talk about validity. Validity asks us one simple question: is the test actually measuring what we think it measures? We'll see. Scientists, they believe that grip strength test only measures hand strength. However, as I was mentioning, researchers and doctors, they put together through all their findings and realize more than just hand strength could be measured through a grip strength test. As we know that not to be true today, larger studies involving over 100,000 people, they found that weaker grip strength test was associated and linked with heart disease, respiratory disease, cognitive decline, and even early death. Now, I want to be clear. If someone has a weak grip strength, that does not automatically mean they have dementia or heart disease. Instead, think of it like a check engine light in your car. When that light comes on, it doesn't tell you exactly what's wrong. It simply tells you something deserves a closer look. Grip strength test works the same way. It's a screening tool. It tells healthcare providers when someone may need additional evaluation. So, whether or not the test is able to tell the whole answer, that not true. However, what it's able to measure, yes, very valid, very true. It is able to give a very close, let's just put it as the reliability, the finding results is excellent to what it's able to detect on whether or not you may be going through health risk or health complications now or even in the near future. Even though this assessment is simple, there are still important ethical considerations. For example, would it be fair to compare the grip strength of a 25-year-old construction worker to an 88-year-old grandmother? Of course not. Their bodies, occupation, and life experiences are just completely different. This is why it's important. Clinicians must use normative data based on age, sex, and demographic characteristics. And it's also important to remember that grip strength should never be used by itself to diagnose conditions like dementia or cognitive disorders. Instead, it should be combined with cognitive testing, interviews, medical history, and behavioral observations. Just like putting together pieces of a puzzle, grip strength is one important piece, but it isn't the whole picture. Therefore, in closing, I want us to know and remember that the grip strength test is much more than simply measuring how hard someone can squeeze. Instead, I want you to realize that it provides valuable information about physical functioning, cognitive health, aging, and just overall well being. It has an excellent reliability and a strong validity. It has been made a global health biomarker. In all of that, I'd like to leave you with one final thought. The next time you shake someone's hand, think about them. You might never look at a handshake quite the same again. It could be your mom, it could be your grandma. Think about that grip, that handshake, and what you're actually feeling. And remember what you learned. The stronger the handshake, the lower the risk. The weaker the handshake, the higher the risk. In saying all this, thank you for all your time. I do hope you're able to complete this presentation and walk away feeling that you have been informed on what is exactly the grip strength test.